We'll move to our next speaker, Dr. Karen DeSalvo, the Acting Assistant Secretary for Health in the U.S. Department of Health and Human Services and the current National Coordinator for Health and Technology. And we're so honored she's able to be with us today to share current federal efforts to improve access to care through telemedicine.
Thank you all for the chance to share our perspective and work in the space of telemedicine, and thank you to Senator Doctor for his presentation. I think that you'll find that we have a lot of alignment with those general principles here at HHS. I thought what I would start with is perhaps a broad frame of our focus within HHS and talk about how health IT fits into it. And then we'll walk through some of the specific ways that we're working to weave telehealth into our policy and technology efforts going forward. Just a broad pickup on where Senator Frist left off, which is that consumers are demanding appropriately and with an increasingly loud voice that they have better care, smarter spending, that they can be healthier using more and more innovative tools that allow not only health care but health to be more accessible to them where they live, where they work, and where they're just trying to course of their daily business. And the healthcare system is working along, and I think it's incumbent upon on us at HHS to make sure that we're doing that in a way that is really increasingly meeting expectation, but is allowing that kind of innovation to flourish, but that we're seeing that it is also becoming more routinized. To that end, as we're working through getting to this place of a better care, one where the kinds of statistics that you saw in the last presentation are flipped, where quality is great and the cost is down, and access to great services. We've been working on reforming the delivery system through a pathway that seeks to change the way that we pay for care, the way that care is delivered, and the kind of the way information is distributed. The paying for care is really about changing to more of a value-based system and away from volume-based or transaction. That pathway and specific goals we set in that area to move the healthcare system into population-focused payment over the next few years, such that by 2018, 50% of payments to providers from us at HHS and Medicare are in the bucket, that value-based, we believe allows for more flexibility and innovation in care delivery in the care system between doctors and their patients in ways that are going to allow for the flourishing of efforts like telehealth and other telepresence opportunities. Secondly, we want to make sure that in the better care space, we're supporting and encouraging the development of models of care with evidence-based to tell working better for consumers and for doctors. They're more cost-effective, and we'll be continuing to support through grant programs and technical assistance and bright spotting just to let folks know where good work is already happening. And thirdly is our work to advance the care system and improve it through the Health IT Foundation. And this is really where the work of the Office of the National Coordinator gets quite intensely focused. That work is our responsibility within as an HHS family member is not only to coordinate across health and human services, but across the federal government to set the tone of policy and technology for the work that we do and the work that we want to do in partnership with the private sector. I'll walk you through a couple of big ways that we've been doing that in the last year and a half that are inclusive of telehealth, to give you a snapshot of how we're looking to really advance the strong foundation this country has built in electronic health records to digitize the care experience of all Americans. This work over the last 6 years has meant that, for example, about 97% of all hospitalizations have an electronic record of it, and about 2/3 of outpatient visits together into a broader picture of health. And more importantly, the world has well beyond electronic health records as the electronic platform. There is a broader health IT universe that we need to count. Telehealth is one of many tools that we need to make sure we're bringing to bear to get this full digital picture, this picture of somebody's health, more than just a healthcare experience from the electronic health record. As we're thinking about telehealth at ONC and how we're working with our federal partners, I just wanted to spotlight a few key areas. One is that we believe that we can further telehealth adoption and interoperability through a set of policies not only related to the technology and to areas of privacy and security, but by working with partners like the USDA on helping to advance broadband access. Secondly, we're looking to incorporate telehealth and in our emerging and advanced health models that we're developing, whether that's through payment or through technical assistance for better care models for programs like our Medicaid and Medicare programs. Thirdly, we're looking to expand access to health care and improve health equity generally, whether that's through our programs in the Indian Health Service or the Federally Qualified Health Center or Rural Health Hospital and Critical Access Hospital programs. Telehealth is a critical underpinning for so much of the access and opportunity for those populations in not only physical health but also in behavioral health. And fourthly, looking to see all the while that we're protecting privacy and security for Americans as they're engaging in not only health IT but also in the broader world of health information technology that's supporting their overall health and care. The priority for us in this last year has been in the space of interoperability. Why? Because this 6 years of some nearly $30 billion investment in electronic health records to lay a digital foundation for what is a sixth of our economy. That information is available when and where it matters for the consumer, for the doctor, for others on the care team. That will help us reduce unnecessary redundancy. That will help us to reduce unnecessary redundancy, and that will help us to get the right quality and care information available to the constituents who need it. That means in many ways that it reduces the burden for needing to go into additional visits. But we also want to see that we don't focus at connecting the electronic systems. Our interoperability roadmap that we released last January and that we'll have a new version of this fall specifically points to the fact that we believe that a critical part of interoperability is going to be that we have to have telehealth adoption. It's going to help us get to a learning health system that is working iteratively to improve health and the quality of care and the accessibility and availability of care and get us to this better care, smarter spending, and healthier people. The language specifically from the roadmap, but we spelled out here on this slide that a learning health system also incorporates advanced health models that increasingly leverage technology such as telecommunications technology to deliver health and clinical services remotely that improve access to care across clinical and non-clinical settings. Interoperability has been a priority for us. We are, of course, as I said, looking at the short-term across institutions, a platform that allows for a broader health IT ecosystem to connect care. We are also at ONC developing the Federal Health Strategic Plan, which is a much broader look at all the inputs and outputs to a strong health IT infrastructure for the healthcare and health economy. And that draft plan includes 35 different departments and agencies across the government that do include groups like the USDA, which has an interest in rural communities, all the way through to Bureau of Prisons, which has an interest in a storied history in using telehealth as a strong tool. That for those of you that would find the draft and the soon-to-be-released final report on our website, you'll see that our strategic plan as a federal government is one that seeks to work across our federal partners to leverage technology to advance access to care. We have some draft goals in there that talk about the adoption and use of health IT, including telehealth and mobile health, that we want to advance a national communication that supports health, safety, and care delivery, including the ability to deliver telehealth solutions. We to improving care quality experience through the safe, timely, effective, efficient, equitable, and person-centered care, and that point to telehealth as one of the important tools that not only the federal partners are already using, but that we'd like to see spread more in the country to increase access to care. I'm going to end on the final place that Senator Frist spoke about a few times, that is always central to the work that we do here at ONC and HHS, which is about the consumer. That's why we get up and come to work every day, is to make life and care better as much as we can for everybody in this country. And what I hear when I go out and do listening sessions and meet with people and see my own patients in clinic is the same themes that were already raised by Senator Frist, but it's worth underscoring, and that is that they have a sense of impatience about the way the health system is not always to them and requires sometimes extra steps for them to get their basic needs met. I think if we're going to improve their care experience, improve their health, and reduce cost, it's put on us to keep pushing forward, but also to make sure we're systematically listening and building a consumer-centered experience, whatever that is. In this case, we took the time in April to on consumer-centered telehealth and the e-visit experience and understand how we would policy and technology in partnership with the sector in such a way that we would be understanding how we would design and enable a more consumer-centered telehealth experience, that we would identify those challenges in the current state that may be payment for telehealth, it might be licensure issues, or perhaps care fragmentation that tools like telehealth and telepresence could really help to overcome, and really help us understand what design principles that would be the right use cases as part of a future telehealth system. Again, not only for our own providers in the federal space, VA, Indian Health Service, the qualified health centers as examples, but really to help lead by example and partner more tightly with the private sector with all the good work that's already happening out in the healthcare space. And so as we move forward and are thinking about our strategic work, the policy and technology work, is this notion of making care more accessible, not just through expanding coverage, but really thinking about how technology can be leveraged to bring care to people in new and innovative ways, is weaving itself into all of our work and documents, and not just strategic in the rulemaking we're doing around changing the way we deliver care in our delivery reform work. I'll just end by saying that I'm so pleased to be on this call with this set of stakeholders, because we're learning a lot as we do this from what we're seeing happening already in the field and kinds of good results that are already happening. And so we look forward to continuing that public-private partnership as we're moving to get into this better care, smarter spending, and better health for everybody in this country. Thank you.